Sonia's got most of her tightness localized down to the lower C-spine structure, same side as the shoulder problem. I'm going to adjust now, Sonia, so I'm just going to get you to relax that head into my hand. Good. Now, we already had, there's another one, we already had some incidental releases just on kind of feeling through Sonia's upper back. We're still going to try to adjust through it before we dig into that shoulder blade. There we go. I'm going to do my darndest to almost try to peel the scapula off the body while digging my fingers underneath to try to work that region. Now, I know that that sounds absolutely horrible and torturous, but I promise it doesn't actually hurt that much, all right? So we're going to start from this angle, then we're going to flip her over, and we're going to dig the hand into the armpit region, or the axilla, because that is the other way to get at the front belly. So, let's get started, shall we? Sonia. Good to meet you today.
Nice to meet you.
Sonia is actually Jess's mom, who was actually just previously featured on this channel. She's here right now. You can say hi if you want to. You literally look at your hi. There you go. So mother-daughter combo today for filming. But I'm going to let her kind of talk about what brings her in today and what she's looking to get out of this appointment. So what are you in for today, Sonia?
Well, I was looking at a physiotherapist before, like a few years ago. And he only found some adjustment or regular routine, but I didn't feel that I have any issues at the moment.
Okay.
However, today I come in because I'm back to the gym. Okay. And I feel like when I'm doing some heavy stuff, this side
left
of my
shoulder.
left shoulder is impacting like a pain. It's painful, and also when I look, I notice that when I look to my right, it's fine, but when I look to my left, I feel like
a pain in
something
there,
is something is there.
Okay.
So I need some help. Maybe.
All right, sure. So first things first, you mentioned that. First off, good on you for getting into the gym. Okay, resistance training, probably one of the best forms of exercise a person can do. Neck and neck with yoga, I would argue. Okay, but good on you for doing it. Now, you mentioned when you're doing certain movements, is it largely those overhead movements, like the overhead press? That
when I'm doing
above the head.
So but it's in this area.
Okay. Do you do any kind
maybe
of...
Maybe it's connected with this, I guess.
It very likely is.
Yeah.
We'll do a physical exam to make sure that that is the case. I'm just trying to get a sense of what movements trigger it the most. So right now we have that overhead, for sure. What about when you're pushing forward, like if you're doing a bench press as you're seated? No, that's okay? No, it's only when we hike up those shoulders.
Yeah.
Okay.
I'm doing some...
So... it was true of her daughter, and it's true of many other patients on this channel, where that levator scap muscle, that muscle that elevates the shoulders up, becomes a very common site of pain or discomfort for people. So that's kind of where my head's going right now with this. But of course, we'll screen the shoulder. We'll make sure that there's nothing wrong with the shoulder itself. Or if this is more just like a neck and an overcompensation issue. But yeah, okay, so you're talking about shoulder and neck. Any other issues, or is that primarily your main focus?
Something that happens... sometimes when I'm training and actually working at home, sometimes I feel like, I don't know if you heard about it, like sometimes it's like a pain, like something like a pinch you, and you are not able to move for a while.
Yeah. When was the last time that happened to you?
Actually, it was in the gym maybe in November.
Okay, so relatively recently, about two, maybe a month and a half ago. We're shooting this in January, early January. So okay, and
but it's very weird.
How long does that usually last when it comes on?
Like a couple of, maybe I'm gonna say 2 minutes.
Oh, 2 minutes.
To get back to like a.
Then is it better afterwards, or is it still
it's
there?
Better after.
Okay, okay. So it resolves within a relatively short time.
Yeah.
Okay. To me, that just sounds like it was a quick little improper movement or a muscle spasm. Tough to know without actually being there in the moment and doing a physical exam. But those happen to everyone, all right? The only thing we can do to try to prevent that is to focus more on mobility as well as muscular endurance and tolerance to whatever load's being experienced, right? If that happens again, when it does, if you're able to come in and I can examine you in that state, that will give us a better idea of exactly what's going on. But for now, I don't think it's something to be too concerned about, especially if it's recovering that quickly. Okay? If you're getting that kind of pain and it's staying on for like days or weeks, then we've got a problem, right? But like if it's like 2 minutes later, you're all good, then honestly, like who really cares? Okay, sorry that that's happening, but you're okay, right? Anything else? Anything else?
My knee.
Your
maybe.
knee? Yeah, okay. What's going on with the knee?
One of my goals this year is actually to do a half marathon.
Okay, good.
Okay,
yeah.
again.
I like that, yeah.
But I've been having some issues with my knee.
All right,
so
that's the right knee. Okay.
my right knee. So something that I don't know if you can look at it.
I'll take a look at it, sure. What are those issues? Like, what's happening
It's
with
like when you're running, it's actually you can feel it like a clack clack. Like
So
there is a click
You
there.
feel the clicking. Does the clicking? Does it hurt? Does it get in the way?
Yeah,
of your
it
run?
hurts.
Oh, it does hurt.
It hurts
Okay,
when
okay.
I'm running.
Yeah, all right.
What I do usually is like I slow down. It's getting better, and then start again.
And then it
like
hurts
a-
again,
yeah.
right? Okay, so like I mentioned before, and if you're getting a clicking or a popping sound, usually that in itself isn't something to be concerned about unless it's symptomatic. Okay, if that clicking, that popping is aggravating a complaint, if it's painful or if it's getting in the way of whatever you're trying to do, then we can take a look at it. Right, but in this case, it seems like it's getting in the way of Sonia's running, so we will absolutely do an examination on it today. So we've got kind of like neck, upper back / shoulder, and knee. Anything else?
This part especially.
This is your main focus,
Yeah,
right? Okay.
yeah.
So we'll screen the other things for sure, but we'll make sure to take a good look at
Okay.
up here today. Okay. So we'll do a physical exam, then again treatment. Sound good? Perfect.
Good.
Sonia was saying that it is primarily her left side over here that's causing her discomfort. We are shooting this at an angle because I got small dimensions to work with here, but we're going to start with the neck range of motion screen. So I'm going to get you to start by bringing your chin down to your chest for me, please. Other direction. So we're going to face forward. Yeah, there we go. Does that bring on any discomfort in your neck or your shoulder region at all?
No.
No? Okay. Now I'm going to get you to look up to the ceiling for me, please.
Okay.
Up. Good, good, good. Any discomfort there?
No.
No? Good. Face forward. All right. Now you also, or she also mentioned that she's got a rotational asymmetry, so let's see that. I get you to rotate as far as you can to the right for me, please. We're able to get to about 70 degrees, not so bad. And now let's go to the left. And there we're limited to about 45. So a noticeable asymmetry between the sides here. Get you to face forward. Bring this ear down to your shoulder. We're going to tilt like that. Good. Any discomfort as you do that tilt?
Yes,
Yeah,
it
okay, so
feels
it's in there. And now what about this ear to this shoulder? Other way. We definitely have more lateral flexion to the right side versus the left. So we've got an asymmetry of the left side in both rotation and lateral flexion. Things are greater on the right side. So now that discomfort, is it primarily... That's the spot that you feel the most? Okay.
Something is there.
Once again, that's the levator scap insertion, like mother, like daughter, same issue. So,
Ooh.
yeah, you two got so much in common. We're still going to do a shoulder screen here. So all right, so keep your arm there. Don't let me move it. Fight for fight. Good. Now give me a thumbs down. Turn around. Keep the arm there. Fight for fight. That's okay? Okay, good. We're going to bend the elbow. We're going to bring this back. Keep the arm here once again. Don't let me move it. Fight for fight. That's we got some discomfort in there. Okay.
Yeah.
So that is resisted internal rotation. We've seen it on this channel before. Internal rotation is primarily done by the subscapularis muscle. I'll walk you through the anatomy on this afterwards because I want to make sure that you understand too. But I'll throw a pop up there for you guys. The subscapularis muscle exists on the underside of our scapula between it and the rib cage and is responsible for internal rotation. So if that is triggering her shoulder complaint, yeah, we've got a left scap component, but we also got a bit of a rotator cuff thing going on too. Let's go the other way now. I'm going to get you to bring this up, and I want you to push your arm into my hand. Push, 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 push. Does that provoke discomfort?
No.
No, that's okay. Good. Put this hand behind your back for me, and try to touch the wall back here with this hand. Does that cause discomfort?
Yeah, I feel something in this
you feel
part.
the pulling
Yeah,
there.
in
Okay,
this area.
that's another secondary check for the subscapularis, so it looks like we definitely have that involvement. You can relax that there. I'll get you to bring both arms up for me. Keep them there, okay? Don't let me move them.
Okay.
Fight for fight. Strong. Good. Strong.
Yeah.
Oh, a little bit of pain with that one, eh? Okay. Bring the arms forward. Curl the wrists backward. Okay, back curl. Other way. There we go. Keep them there. Turn it over. Curl the wrists inward. Good. Fingers curled. Good. Turn over. And please gently squeeze my fingers. Perfect. Good, good. Well done. All right. I'm going to turn this over. Relax the arm for me. Good. Good. Drop that arm. Drop, drop. Let me hold it. That's not dropped. We got to relax. There we go. That's what I'm looking for. There we go. You gotta move out of the way so that the camera's not just looking at my butt. Good. Good. Bring this arm up, drop, drop. Good. There we go. So as I've said once, and we'll say 1,000 times more, anytime we're dealing with a local issue, good form to look both above and below the chain. So in relation to the shoulder, if you have a shoulder issue going on, you will inevitably start to develop neck and upper back issues, and vice versa. If you have a neck issue, you'll develop upper back and shoulder. If you have an upper back issue, you'll develop neck and shoulder. They're very biomechanically interconnected, these three. So good form to check and screen for all three if you are having an issue with any one. So that's what we're doing here.
There you go.
Right there, eh?
Yeah.
Okay. So that is the left scap insertion, which sits right on top of kind of like the second thoracic, third thoracic rib head. So we'll adjust in through there for certain. We're also going to need to work, as we saw in the orthopedic test, some of that subscapularis muscle, which is always fun to work on. And when I say that, I mean it's not the most comfortable thing, so sorry in advance. But we'll make sure to work that well today as well. Ooh, that was an incidental release there.
Is that caused by what? By stress, by position?
Like that kind of little cavitation you had right there, that release?
No, the
the shoulder issue. Or are you talking about this specifically?
Yeah.
So stress is the great exacerbator. Now what that means is that if you have any kind of minor condition and you add stress on top of it, whether that's mental or emotional or physical, you will worsen any problem. Okay, so like as far as this, it was probably caused through maybe some postural issues, or perhaps you just like strained it one time, and then stress can exacerbate it. Does it come from stress itself? Maybe. It's tough to know, all right?
Okay.
But at the end of the day, it's treated the same way.
Okay.
So, yeah.
Because I just think that is this a stress why it's not showing in both instead of one?
We have imbalances all the time, all right? I was explaining to Jess as well earlier that some people even carrying groceries more on their non-dominant hands, so they can use their keys on the right hand. Like we are asymmetrical creatures, all right? So for whatever reason, you get it on the left, not the right. And as I mentioned, so you've been adjusted before, yes, Sonia? Or you've been cracked, so to speak? Yeah, okay, by your previous chiropractor. So checking in through the neck, let's take a look at what we can find. So Sonia's got most of her tightness localized down to the lower C-spine structures, more so than the upper. On that left side, same side as the shoulder problem she's having. So let's check out the other side. Oh, look at that, incidental release. Lots of them. So we're going to adjust now, Sonia. So I'm just going to get you to relax that head into my hand. Good. Well done.
Feels good.
Happy to hear that. It usually does. Yeah. All right, we're going to check. We're going to do that one more time for higher up. I think there might be a little something there, so we're just going to be thorough here. Oh, that's okay. And once again, just drop the head into my hands. Ooh, lots on that side. Now, we already had, there's another one, we already had some incidental releases just on kind of feeling through Sonia's upper back. We're still going to try to adjust through it before we dig into that shoulder blade there. So, Sonia, I'm going to get you to take a big breath in for me. And all the way out. Good. Good stuff. One more in. All the way out. Good. There we go. So that's the T-spine. We still want to get into those CT junctions or that left scap region there. So for this next one, I'm actually going to bring the mic over here. Good. Now this isn't her problematic side, but I still feel a little something there, so let's see if we can release that. I'm going to get you to take another big breath in. And all the way out. All the way out. I'm going to turn your head. Oh, okay. All right, take a breath in, and all the way out. Okay. The subscap is a very tricky region to reach from a massage therapy perspective. Why? Because once again, it is underneath our scapula, okay? It also, it originates, from the medial aspect of it, or the inside aspect, so I'm going to do my darndest to almost try to peel the scapula off the body while digging my fingers underneath to try to work that region. Now, I know that that sounds absolutely horrible and torturous, but I promise it doesn't actually hurt that much, all right? So we're going to start from this angle, then we're going to flip her over, and we're going to dig the hand into the armpit region, or the axilla, because that is the other way to get at the front belly. So, let's get started, shall we? Better for the camera if I do it the other way, so there we go. And we'll also work that left scap region because we're in the area. Let's be sure to cover all our bases. Thorough. That's the word that I couldn't remember.
You feel that? You feel my bone?
Right there. Yeah. That's not bone. That's your levator scap that we were talking about beforehand. But it feels like bone because it's just so hypertonic or so tight for whatever reason. So there's our medial border of the scapula. Now, in order to get underneath it, it's actually quite helpful to move the patient's entire upper limb. So the way we're going to do this is I'm actually going to snake my arm under here, and I'm going to kind of grab your shoulder. Okay? Just like so. And then what I'm going to do is slide like that. There we go. Little uncomfy, yeah?
A little bit.
Yeah. Now, if it's too much, you say stop, but this is how we get the subscap, and we're reaching it quite well on you, so.
I want you to fix it, so I'm gonna...
Oh, don't worry.
Wait.
I've fixed many a subscap. We'll add you to the list afterwards, no problem. Okay. Oops, sorry.
Wow, you're in the right spot.
Oh, good. I'm usually pretty good at finding the right spot, so.
Ooh.
Right there. Okay.
When you were working in my backside, the fat of the cold and the heat, it feels good, like something that you put like a coal there, or the tool, plus the something hot. It was really good.
So Sonia was talking about sensations of cold and then sensations of hot. This is tender as I work in here. I can see on your face. Yes?
Yeah.
Yeah, okay. I'm on the subscapularis with this. Remember, it exists on the front of the scap. I'm digging into the armpit because that is the easiest location to get at it. But as Sonia was saying, she was feeling the sensation of cold and then hot. Now, I do use an emollient, a lubricant, an oil, whatever word you want to stick on it, so that the tools slide nicely on the skin, which I guess is kind of a little bit of a cooler temperature. But I don't use anything hot. So it's interesting to hear that she said she felt warmth afterwards. What is that? Well, one of the mechanisms of action for instrument-assisted soft tissue therapy is almost like a targeted, a way to target localized blood flow. What does that mean? So if I stimulate an area enough mechanically, we will eventually get blood to rush into that area as a response. That's good because blood flow is how our body heals stuff. Okay, blood flow brings all the necessary building blocks that we get from our digestion into a region to build things back better. So we also perceived increased blood flow as warmth. So what that means is that with these tools, we are able to stimulate localized blood flow into that subscapularis region, which helps to promote recovery. So I'm happy to hear you say that, actually, although I had to think it through because I haven't had anybody give me that descriptor before.
I actually, it feels like you were really moving my muscle inside, I don't know, my scalp, as you call it.
That is 100% what I'm trying to do right now. Really taking a massage therapy approach. It's a great example of how I am not a massage therapist, but incorporated into a diversified technique.
Very good. Feel good.
Happy to hear, she said, painfully.
Yeah. It's painfully, but it's relieved, right? Like a...
Slipped off there. Now, I don't know if you're noticing this, but as we work this region harder and harder, you are being able to get more and more rotation in that shoulder there because the subscap is releasing and letting go. So that's very good.
Oof, there is something there.
Yep.
Oh,
ooh, found a spot. Okay, we'll go a little bit lighter there. All right. Want to make an omelet? You got to break a few eggs. I think that's the saying, right? I don't know how to say eggs in Spanish. Huevos. 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 Okay. Last name Solis. I'm a disgrace. Yeah. All right, we're gonna take a rest there because you look like you're getting worked. So you can take that back for a second. I'm gonna grab a tissue. And I'm going to clean up kind of the excess oil there.
Feel like it's burning there.
Yeah, again, we got that harsh, not harsh, we got that warm sensation going on. Targeted blood flow, okay? Good stuff, okay.
Oh, that's good.
I don't know too many people who dislike this thing.
Oh, you're in the area.
Right there.
There you go.
Right there. That's the spot.
A little down. That's the spot.
There it is. Found it.
Oh.
Usually pretty good at finding the spots.
Wow. I can have that machine running in my body all day.
Oh yeah. I sell them if you want one. Alright, so the last thing we're going to do today, Sonia, is going to be a little something called MRT. It's very simple. I'll walk you through it. It's a different form of massage. I'm going to get you to start by looking up and to the left for me. Okay? I'm going to take an elbow. I'm going to put it right here. Go ahead, stay up to the left. And up. Good. And now, with this contact, I want you to now slowly look down and to the right for me, please. Go ahead. Good. And come right back up, up to the left, and up. Good. And now slowly down to the right. Go ahead. Tender, huh? And down. Good. Up to left, come right back. And down to right. Yep. Good. One more, up to left. And now slowly down to right. And down.
Oh.
Good. There we go. All right. Face forward. I want you to tilt your left ear to your left shoulder like that. Good. I'm going to take my elbow. I'm going to put it in right there. Now slowly look down into the right. No, sorry. Slowly tilt your right ear to the right shoulder, please.
Down?
No. Right to right. So you're going to go like
okay.
that. There we go. Yeah, my mistake. I misspoke there. Left to left. And right to right. Doing 2 treatment videos back to back takes a lot out of me. Yeah, it really does. Left to left and right to right. And left to left.
Wow.
Ooh, that's a spot. Same spot on you. Left to right. Okay. And left to left. Right to right. And I'll say that that's good there. I don't want to beat you up any harder than I already have today.
Yeah.
Okay, now we're going to do the other side.
Okay.
I'm going to let you look up and to the right. And now we're going to get you to slowly look down and to the left. Okay, down to the left. Good. Up to right. Slowly down to left. Up to right. Slowly down to left. And up to right. Slowly down to left.
Wow, a lot of click, click, click.
Lots of them. Face forward. Tilt right ear to right shoulder, just like so. And now left ear to left shoulder. Go ahead. Good. And right to right. Left to left.
Oh.
And right to right. Left to left.
Okay.
And last one, right to right. Left to left. Good stuff.
Oh.
And shrug your shoulders up.
Do you want her to talk about
I just remembered that literally on the last rep. There. All right. I'll get you to shrug your shoulders up for me.
Okay.
And slowly lower down. And up. And slowly lower down.
Ooh.
And up. Slowly lower down. One more up. Slowly lower down. Good.
Oh
Okay.
my God.
Feel good?
Oh, I feel good.
Very happy to hear.
Oh.
Sonia, how did you find all of that?
It was amazing. I honestly feel good. I never been in a chiropractor doing all the stuff that you did to me today. I think everything, the tool was new for me, and the heat and the cold, I really like it, and I feel good with that sensation. It was good too. The good thing is, like, I feel like, you know, better.
Good.
You know, after all of this session.
I'm noticing there too, you're actually turning further than you were beforehand to that left side.
Yeah,
which was the
I
original
feel
problem.
it as well.
Yeah, I
right?
can see that.
Like,
That's good improvement.
There is some improvement there. Of course, I would like to continue with, because I feel like there is some impact, some better, right?
Good,
some
good.
improvement.
Happy to hear.
Yeah.
Sorry,
yeah.
was there something else you're going to add? I feel like I cut you off there.
No, I really like the way that you are conducting this session.
Well, I'm thankful for that.
Yeah, I'm happy to be here.
So, like, yes, I am a chiropractor, but I practice what I've kind of explained to these two and many times on the channel, a diversified technique, meaning that I steal elements from various other practitioners, right? So, I take a chiropractic, a massage therapy, an osteopathic, an acupuncturist, and physiotherapist kind of approaches. I combine all 5 into what I do plus a few others. A lot of traditionalist chiropractors, they'll adjust and send on the way, which isn't enough for a lot of people. They require more comprehensive care, such as the case of a rotator cuff muscle strain, which is what we're dealing with here in Sonia, right? Taking very much a massage therapy approach, and we'll also take a physiotherapy approach as we progress alongside the treatment plan here.
I actually like the educational part that you are adding to the session. You know, all the details that you are giving me. I really feel like I understand exactly what I have, what is the issue with me, and how to treat it. I really like it.
I am a huge fan of patient education, okay? And it's actually funny that you mentioned that, because the World Health Organization, the WHO, actually just published new guidelines for the management of chronic low back pain, which can be extrapolated in some senses to other conditions, the chief of which is actually patient education. So we have research to support the idea that educating the patients and teaching people how their bodies kinetically function is beneficial to their outcomes. So if you are a practitioner and you watch this channel, you need to do a good job of trying to educate your patients what it is you are doing to them and what they can do to help facilitate their own recovery, because when you empower the patient in that sense, they are able to make more educated decisions about how to better handle their condition. If I were to be completely silent or not have any kind of academic or educational, component to what I'm doing here, I'd be doing a disservice to them. Now granted, when the camera's on, I do go a lot more in depth than what I normally do in my normal sessions, but my normal sessions are still educational. I still do my anatomical cutaways for people so they can understand their body. And if you're a practitioner, you should be doing the same. So I'm happy you see value in that, because there is a lot of value in
There is a lot of value, and actually I can tell you it is a very good strategy, you know, to have your clients or patients educated. I actually work for the Ministry of Health.
Oh, I didn't know that.
Okay, we work for the public
I meant to ask you like what it is that you do. I usually do that during the massage session, but it slipped my mind again. I can't do 2 treatment sessions back to back. I get tired. But what is it that you do then? Tell us about that.
I work for the Ministry of Health in IT. With the public health units. That is one of our always try to implement education part to the users from the public health units. You know, the way that way you empower them.
Empower. There's that word again.
To be you know, to do their best, and we feel better, more confident, knowing that they know what they are doing.
Exactly.
Right? So the educational part is a key.
So I'm happy to hear or agree with
you. You are doing so good. I think, you know, you are a millennium guy, actually a millennium chiropractor.
Yep, I'm a chiropractor.
I'm happy to see that you guys are implementing, you know, those strategies in your curriculum and implementing in your day-by-day work.
100% curriculum. I mean, like, truthfully, I'm just doing what I was taught. Okay, I went to CMCC, which is Canada's largest chiro school. There's 2, but one's in Quebec. It's all French, so that rules out 80% of the population. But I went to CMCC, and they very much promote this kind of evidence-based model, and the evidence points to patient education. So we kind of got sidetracked there, but like that's really cool that the Ministry of Health is taking the same approach that I am, or alternatively, I take the same approach that the Ministry of Health does, because I think they take priority over me in this kind of grammatical sentence.
I think every doctor, everyone have to implement
100%. Couldn't agree more. Do you have any other questions for me before we kind of sign off for today? Are we good to call it now?
I think no. I'm happy with whatever I have today, and I feel better.
Good.
I know I'm gonna be a little in pain this afternoon,
but sore probably. Yeah, she got worked.
Yeah, but yeah, I'm happy to be here, and thank you for this opportunity.
Happy to have you.
And I'm happy to contribute with you as well. So
we'll talk about treatment plan and everything after. Okay. Well, good seeing you.
Good job.
We shake hands. Take care. Okay.
Don't forget to like, comment, and subscribe.
Thank you so much, Sonia.